Namaste, I am Dr. Siri, infertility expert practicing more than 15 years, and I practice at Karuna Fertility and Maternity Center, Nagarbhavi, Bengaluru. IVF is a very advanced procedure when it comes to infertility treatments. And when the couple goes through an IVF, there's not just a medical burden on them, but there is a psychological and financial burden also on the couple. So when the IVF procedure is undertaken, there are two things that will determine the success of an IVF. That is the embryo quality as well as the endometrium lining the uterus. When in spite of both being good, still there are chances that the IVF may not be successful. There might not be a successful implantation and no pregnancy. So the main things that affect, as I told you, is the embryo quality as well as the endometrium. So just because the embryo is a very good quality doesn't always guarantee us a pregnancy. There are some unknown factors like endometrial and embryo crosstalk. That means there are a lot of immunological processes. There are certain exchanges that happen between the embryos as well as the endometrium. So that is what is the reason for the implantation to occur. Definitely a good embryo gives us a very good hope and the chance that there can be a pregnancy following that. But also what has to be kept in mind is, though sometimes the embryo looks very good, it may not genetically be normal. That is, it may not be euploid. There might be something called aneuploidy where the chromosomal numbers are abnormal, because of which though the embryo when we grade looks absolutely great, will not be implanting, or even if it implants will result in an abortion. So a good embryo does not always guarantee a pregnancy. Endometrium is nothing but the inner lining of the uterus. So the endometrial thickness is one thing that we look for when we are transferring an embryo. So what is the normal range? So we have seen maximum pregnancies happen somewhere between 8 to 12 mm. Though we have seen pregnancies in endometrial thickness less than 7 or 8, and also sometimes more than 13-14 mm also we have seen pregnancies happen. But the window where we are looking for a good transfer is somewhere between 8 to 12 mm is the endometrial thickness. And what we should know is, it's just not the thickness that matters. There is a pattern of the endometrium also when we see the scan, that a triple line is a very good endometrium, and the hormonal changes in the body is reflected in the endometrial imaging also. The volume of the endometrium and the blood flow to the endometrium also determines a pregnancy. Sometimes a thin endometrium with a good blood flow and a good pattern is sometimes very good for implantation, rather than just having a thickness with hyperechoic or no blood flow or minimal blood flow, then it may not result in endometrium. And it's just not the ultrasound finding of the endometrial thickness that matters. We do see procedure called hysteroscopy, we see how the endometrium as such is. So if there are red spots seen or inflammation seen in the endometrium, then we call it as endometritis, where there is a infection. So we have to treat that infection and then do an embryo transfer, which will result in a successful pregnancy. There are many factors for IVF failures. It could be the anatomical factors, physiological factors and immunological factors. So when we are evaluating why an IVF fails, all these factors have to be evaluated. And here in this, the genetic factors also play a very important role, because an embryo is 50% carries mother's genes and 50% father's genes. And we all know that any foreign particle that enters our body is considered as a foreign, and the body starts to react and starts to produce antibodies and starts fighting against it. So when there is 50% of father's genes in the embryo, there is a beautiful mechanism where our immune system doesn't identify that embryo as foreign and accepts it. But in some cases, there is something called immunorejection, where the immune system in the body starts rejecting that embryo as foreign and starts producing antibodies against it, and which will result in either pregnancy loss or no pregnancy at all. So that needs to be evaluated, and it is very difficult to actually evaluate it. There is a lot of research going on in this field, and the other aspect is the genetic aspect. So we do test both the parents or the couples for their karyotyping to see if there are any genetic abnormalities in the chromosomes, if there is any translocations or any chromosomal abnormalities which would be resulting in either abortions or infertility as such. So definitely that also has a great role to play when it comes to genetic and immunological testing. We by now know that a pregnancy depends upon the embryo quality, the endometrium, as well as the endometrium embryo crosstalk. So whether a good embryo again will result in a pregnancy is not a guarantee, because though the grading is a very good tool to know the quality of the embryo, doesn't give us the complete picture of how the embryo is. So as I told, the embryos can be graded as grade A, and still if the chromosomal content of that embryo is abnormal, then it will not result in pregnancy, or it will result in pregnancy loss. But as such, grading is a very good initial tool to select for a transfer or not. If we usually transfer grade A and grade B embryos and discard the grade C and for the grade D embryos, because they could negatively impact even the good embryos. So we generally try to select the grade A and grade B embryos for transfers. Stress and lifestyle affects our day to day normal health as well as the embryo implantation dates also. When there is stress, there are different hormones that are produced in our body which could negatively affect and cause inflammatory changes and can negatively affect in embryo implantation. So having a healthy lifestyle, good eating habits and stress-free mind definitely improves the chances of implantation or pregnancy to some extent. Recurrent implantation failure by definition says failure of pregnancy after 3 transfers. So we will not wait until 3 failures. So we usually start our evaluation after 2 transfers itself. And as I told you, there are many factors that affect. It could be anatomical factors where there is some structural abnormality. So we would like to test if there are any fibroids or small growths like polyps in the uterus, or there is a membranous septum in the uterus. So 3D ultrasound of the uterus helps us know that. Sometimes there can be an infection in the lining of the uterus, that is the endometrium. So a hysteroscopy will help us rule out that. Then coming to the physiological factors. So there might be many physiological reasons, as in could be some endocrine factors can be there, like PCO hormonal imbalances can be there, thyroid or even prolactin levels, they need to be tested. Then coming to the genetic factors, we do karyotyping for both the couples, and we check for their genetic tests, and also before the embryo transfer we could be doing a PGTA where the genetics of the embryo is also tested for any aneuploidy, and then the embryos may be transferred. Then we look into other physiological factors like if the parents are diabetic, or if there is any other diseases of the heart or any other which could be intervening the pregnancy. Then coming to the immunological factors. So there are a number of immunological diseases which could be interfering with the pregnancy. So some of the commonly tested ones are antiphospholipid antibody syndrome, and there's a HLA typing that will be done of the couples. So if there is a matching or if there is a mismatch between the couples. And there is other tests like endometrial receptor assay. So this will help us understand whether the endometrium is in sync with the embryos, and if they are within the endometrium, the window period of implantation, or if it is outside the window period of the implantation. So again, who has to be tested for all this? I think the clinician is the best person to advise what tests to be done, and it is not a blanket test for everyone, but it is very much individualized as to see what could be the probable cause.